Hello and good day. My name is Cedric Celera. I'm a third-year resident from East Avenue Medical Center in the Philippines, and my study is entitled Achieving Closure in Orthopaedics, Closed Incision Negative Pressure Wound Therapy for the Postoperative Care of Closed Orthopedic Wounds, a Systematic Review and Meta-Analysis. So the care of orthopedic wounds is important to prevent complications such as infections, dehiscence, and other complications that may lead to prolonged treatment. For orthopedic procedures in particular, poor healing may lead to several complications, such as osteomyelitis and peri-implant infections. And even in successful procedures, complications may arise from wound care-related problems. Traditionally, negative pressure wound therapy has been used for complex wounds, such as avulsions or chronic ulcers. It has been suggested that NPWT may improve wounds by reducing local toxins and bacteria, increase blood flow, reduce interstitial edema, increase lymphatic drainage, stimulate cellular proliferation, and improve wound biomechanics. In the past decade, there has been increased interest in the use of NPWT in closed incisions, leading to its use in abdominal, thoracic, vascular, obstetric, and surgeries to the extremities. In the field of orthopedics, it has been used by arthroplasty and trauma. It has been proposed that high-risk wounds will benefit from CINPWT by decreasing surgical site infections, wound dehiscence, and wound complications. The current literature regarding CINPWT has had unclear outcomes and mixed results, and there is still no consensus regarding the guidelines for its use. The objectives of our study was to compare the effectiveness of CINPWT compared with standard wound dressing in patients who underwent orthopedic surgeries. We performed a literature search from various search engines and databases and reviewed and selected according to a set of inclusion criteria. We only included RCTs. We only included studies including patients who underwent operative management of extremities and spine. We did not include non-RCTs and studies on the non-extremity wound care, including abdominal, thoracic, obstetric, and vascular injuries. So from 127 records, we came down to 21 studies to be included in the qualitative analysis and 9 studies included in the quantitative analysis. Here is the list of the studies that we included in our meta-analysis, and these are all prospective RCTs, with the populations and the outcomes listed here. So we had 4 outcomes. The first outcome was surgical site infection, and it was seen that there was no difference in the risk of SSIs between the CINPWT group and the standard care group. Our second outcome was surgical site complications, and there was no significant difference in the risk of surgical site complications between the intervention and the control group. Our third outcome was wound dehiscence, which was seen to be significantly lower in the intervention group compared to the control group. Our fourth outcome was length of hospital stay, that seemed to be significantly lower in the intervention group compared to the. So we can see that the role of CINPWT in decreasing surgical site infections is owed to several factors: decreased wound discharge and providing a clean, controlled environment for wound healing. We saw that the risk of wound dehiscence was significantly lower in patients treated with CINPWT compared to standard care. The risk for development of SSIs was lower, not significant. The length of hospital stay was also lower in the CINPWT group, and the wound complications were very variable in the study. You can see that CINPWT improves for wound dehiscence, risk of development of SSIs, and the length of hospital stay. And in conclusion, we can say that CINPWT is a wound care option that may be recommended in high-tension wounds, especially in orthopedic surgeries. However, we may recommend that there still be feasibility studies done, especially in low-resource settings, and we may also include in further studies alternative or makeshift negative pressure devices. Thank you very much. That's the end of my presentation.